Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Dr. Thomas Farley, the Health Commissioner for the City of Philadelphia, about the COVID restrictions they have put in place, the toughest since the early days of the pandemic in March and April. Let's listen.
Thomas Farley, thanks so much for joining me.
Thanks very much. It's good to be here.
So you are the Health Commissioner of the City of Philadelphia, and you have put in place some pretty strong COVID-related restrictions in recent days. And I'm wondering if you could share those with us.
We put in place restrictions. You described them as strong. They're a lot less than what we did in the spring, but we tried to have them be very targeted around where we think the spread is occurring now. And strong enough to make a difference to prevent this current surge from overwhelming our hospitals or killing a large number of people unnecessarily. What they do is there is a prohibition on indoor gatherings of any size in any location. So taken literally, that means you can't have a friend over to your house for a cup of coffee. Now we know we can't enforce that, but we hope that sends a strong message that really people should be staying away from people outside of their household. And related to that, then we have a prohibition on indoor dining, although we allow restaurants to do delivery and takeout and outdoor dining. We have prohibition on indoor gyms and libraries and museums and theaters, places indoors where people gather. But we allow outdoor gatherings of a variety of sorts under some density restrictions and under a rule that outdoor gatherings, they can't sell food and beverages because they're selling or serve food and beverages, because if they do, then people aren't wearing masks. And so it's really meant to try to have it be so that people either are not gathering at all, or if they're gathering, it's outdoors and people are wearing masks.
Mm-hmm. Not being able to have anybody over at your house, that's a really strong message.
Is, we looked at things like saying no indoor gatherings of 10 or fewer, but our information from contact tracing suggests that a lot of this transmission is occurring in indoor gatherings of 5 or fewer. People have 3 friends over to watch a football game and they spread the infection. And because these friends or relatives or people that they know and trust, they're not wearing masks. And so we're really saying, no, you should not be mixing people indoors that you're not already exposed to in your household while not wearing a mask. And so we were very forthright that this was something that we could not enforce and would not enforce. But we really wanted to send a message that no, you should not invite people over to your house for a gathering or should not have a larger gathering, a wedding or a bridal shower. We're having plenty of spread in those settings as well.
Mm-hmm. Is this something, as you said the contact tracing really told you that this was the answer?
Yeah, the contact tracing was not designed to determine how people with infection got the infection. However, in the process of interviewing those cases to see who they might have exposed, to identify those contacts, we do have a conversation with them about how they might have gotten exposed. And about half of people have no idea how they're exposed. So we think that there's a certain amount of spread that's a little bit everywhere. Then of those that do know or feel that they know where they got the infection, it's from household members, it's from visits from one household to another, it's from small social gatherings, and then it's from large social gatherings, and then miscellaneous things like offices and other workplaces where people were taking their masks off over lunch.
Mm-hmm. Now you've also suggested that people work at home if they can.
Yes, because we are seeing a spread in offices. It may be that it's okay for people to be in offices wearing masks, but we find that people get comfortable with their coworkers in the same way they get comfortable with their friends and relatives, and they take their masks off. And so if people can work from home, work remotely, there's no reason that they shouldn't right now.
Mm-hmm, mm-hmm. Now, are schools open where you are?
We allowed elementary schools and middle schools to continue to do in-person education. But we said high schools should be online only, feeling that high school kids can learn remotely, can learn over the computer, but kids in elementary, middle school, it's much tougher for them. And also, we had and have a model for these sorts of restrictions in Europe, in France and Germany, UK, Italy right now. They have done these restrictions where they prohibited indoor dining and theaters, museums, and gyms, but they've allowed their schools to stay open. And those restrictions appear to be working. They're seeing fairly rapid declines in the epidemic right now in France and a turnaround in Germany.
So where I live, right outside of Baltimore, my children can't go to school, but I could go out to a bar until 10 o'clock tonight. That seems like a sort of skewed priorities.
Yeah, I think that's just plain wrong. We absolutely know that bars are very high risk. They're even higher risk than restaurants. And we know, if nothing else, than from the example from Europe, that kids can go to school and have very low risk. The kids, we've learned, can be made to wear masks. Even preschoolers do fine with wearing masks. They probably do better than teenagers do. So schools can be done safely. Bars cannot be done safely. And to our society, isn't it more important for us to educate our kids than for people to be able to drink together?
I agree with you wholeheartedly. So tell me, are you getting pushback?
Absolutely. The gyms don't like it, and the museums don't like it, and the restaurants don't like it. This something in the spring, we had much tighter restrictions, and people accepted it because at that time there was a real panic about COVID. Now that it's been around for 8 months, people are less afraid of it, even though it's just as deadly. And so the businesses are raising complaints about this. There's another reason why we're getting pushback, and that is because there was financial support from the federal government in the spring, which isn't there right now. That the CARES Act runs out on December 31st. So I'm sympathetic to the businesses that are affected, where they don't see a financial support from the federal government. I hope that financial support is coming, but we really can't wait for that right now. The surge is happening right now. By our projections, our hospitals will exceed the peak that we hit in the spring in about 3 weeks. We're going to have to act now so that the hospitals are available for people if they get sick with this.
I think that's the scariest part right now is how rapidly the hospitals are filling up. I mean, if someone were to have a heart attack, they could potentially not be able to get the care they need once these hospitals fill up.
There's absolutely that risk. And, in the spring, to give you the sense of this, we had our shutdown on March 17th, at which time we had about 5 cases reported in the entire city of Philadelphia. It took till April 24th for us to hit our peak in the hospitals, and we peaked at a very uncomfortable level where hospitals could just barely handle it. So you need to think ahead in all this. Now we're seeing nearly 1,000 cases a day, and we're just starting our restrictions. So where is this going to peak? How far out, if these restrictions are effective, and how high is it going to be? I'm quite worried that it's going to be worse. It's in the spring, and I don't know how much additional slack we have in those hospitals.
I understand these restrictions go until January 1st at this point.
Yes.
So that's a long time. Are you plan to reassess, I imagine, at that point? And what are you going to look at when you reassess?
It's 6 weeks, which I'm saying is not that long a time when you consider that we've been in this epidemic for 8 months already. And that everybody who's uncomfortable with them, which says just 6 weeks. And it's 6 weeks between Thanksgiving and New Year's, during a time when most people don't accomplish much anyway. So let's be clear about that. But we will be looking at what happens, particularly in our case counts. Our daily case counts continue to rise at an exponential level, which is how they're rising right now. And secondarily, how our hospital capacity, how's that going? Is it leveling off? Does it look like we're going to exceed what our hospitals can handle? We're also going to take into account, frankly, the where we are with our ability to vaccinate people. We just heard today that Pfizer submitted their emergency use authorization. We may hear soon how many doses we're going to get. If we can cover a high percentage of our most vulnerable population, then it doesn't matter too much how many cases we have out there, because we know most people with this infection handle it fine. And so I'm hopeful that we can knock down this epidemic wave just enough to tide us over until where we vaccinated enough vulnerable people. Then even if we have a resurgence after we end the restrictions, that we haven't done much damage.
Mm-hmm. And I guess that's sort of the message I've been hearing. For example, I think I just saw Dr. Fauci say, sit tight. Like the cavalry are coming. We are close. And the last thing you want to do is get sick now.
Yeah, that's what I was saying. We've been managing this for 8 months. We're so close, just hang in there a little bit longer. And 6 weeks isn't that long. I've said to other people, death is permanent. So this is just temporary here. Not to say when we were thinking about these restrictions, I laid out projections of, okay, here's how many people are going to die in the next 2 months. And then I asked myself a pretty uncomfortable question. How many deaths are acceptable? And that was sort of haunted me for a few days. And I said, well, I don't think that we can accept too many deaths. I think we need to do something to reduce that. And most people haven't really asked that question, but I think that's what we all need to be doing right now is ask that question.
It's a really scary question to have to ask yourself.
Yep.
Right? I mean, you don't envision that that's what you go into this work for.
Yep.
A lot of your colleagues around the country have been attacked for their stance on these things, for their encouragement of restrictions on businesses. Are you getting that sort of feedback?
Not so much personal attack. I mean, we're getting the kind of political pushback that you would expect. Fortunately, I work for a mayor who is really committed to public health, and he's been a very strong defender of these actions. And Philadelphia is a city that appreciates health, and Philadelphia appreciates the people who are least fortunate in our society. And everybody here understands that those are the people who are going to die from this. And so I think most people understand that we're doing this to protect those people from really suffering.
Well, Tom Farley, I really appreciate your time.
Okay, thank you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.